I would like to start by saying that the topics that we selected today, we did not know a month ago. We did not know a month ago where we were going to be with respect to the next round of federal stimulus. As you know, Pelosi and Mnuchin spent the better part of 2 weeks negotiating to try and get something done before Election Day. That is not going to happen. But as you'll hear later on from Jeff Paley, we do have what I consider to be a plan in place to inform you of all of the changes that might occur between now and that next stimulus bill, as well as summarize the effect of that bill as well. This slide, all I want to say to you, you can read it, but it's fairly standard for any kind of a webinar of this nature. It is being recorded. You all have your own professional advisors, accountants, attorneys, and consultants. We want to be sure that you are in your position not taking this guidance as gospel, but by all means understand that if there is any matter that you would like to discuss with us directly, you have all of our information, both phone and email, at the end of the presentation. So to get started, and I think those of you that have seen me present before, I always provide you with more PowerPoint slides than I intend to cover in detail. There's a reason for that. I believe that this is, in my 47-year career, the most important time for you as management, or if we have board members, we need to educate our board leadership and our board to the extent possible with respect to what I describe as the last 8 months, which has been the most difficult time for management of a nonprofit organization in the entire extent of my career. I believe that boards are going to need to be educated continuously with respect to the changes, and those of you that are in leadership positions know how confusing it is to hear one day a particular recommendation that gets changed the next day. Those types of things will continue to occur, as evidenced by this slide, and as a result, we want you to use this material for any purposes, management groups, board members, whatever you want to use it for. It's intended to give a snapshot in this first section of just what we're up against and what we've been able to muddle our way through over the course of the last 8 months with tremendous lack of clarity in many areas from both the federal government and uncertainty, not lack of clarity, but uncertainty from Governor Cuomo and New York State with respect to our budget woes, which I'll get into in a minute. The other thing we've provided here, we are going to spend a fair amount of time with Margaret Lally from our office on the HHS Provider Relief Fund information and the confusion associated with that and where we are today and where they're going in their next step. But keep in mind that Leading Age has what we consider to be a very, very good and timely website. That's essentially the long-term care organization in New York State, primarily nursing facilities and home care. And that particular website we've selected for purposes of referring our clients because they do cover a wide spectrum of the various issues and topics we're going to be discussing today, but particularly HHS and Provider Relief Fund information. And then, of course, we do expect that Pelosi and Mnuchin and whoever happens to be in control of Congress or the White House come January 20th, we do expect there to be another Paycheck Protection Program. So those of you that have received a PPP may, and I've read, likely will get another bite at the apple, but there will be additional, if you will, eligibility tests and thresholds undoubtedly related to that. We're up to 52 questions on the Treasury Department PPP document, and it is very obviously important to make sure you reference that. Not going to go through backgrounds necessarily, just consider yourself in front of, on the camera, subject matter experts from Bonadio, and we will try to keep this as substantive as possible with respect to the information to be provided. Jeff Paley, Margaret Lally on PPPFA, and then the Provider Relief Fund, John Miller and Mike Bomer, and then Terry Phillips will be presenting on the cost reporting and financial reporting issues that are unique, I think, in New York without having a tremendous amount of clarification at this point. But Terry's got some good news, I shouldn't say good news, good information for you relative to his contact with folks at the state of New York. And then finally, for those of you that are now up to 400, for those of you that are on the call and you've never been subjected to a single audit before, I would strongly recommend that you call your independent accountants or us, because it is a very, very significant element of reporting that's going to be required related to HHS funding, and you need to begin the documentation process when you've received and when you've expended those funds, and Margaret will talk about that a little bit more as well. But it's extremely important that you cannot, as many of you have done during the course of my career, you cannot do your cost report either for CFR purposes or for any other cost report or for HHS stimulus funding under the single audit. You cannot do it at the end of the year. You should not do it at the end of the year, and you should be doing it throughout the year. Our general recommendation is quarterly reviews of that information to make sure that we do have the necessary documentation. The last thing you want to do is have documentation missing at the end of the year and have the auditors come to you and say, we need to report this as an exception with respect to your use of federal funds. That doesn't go over well with boards, it doesn't go over well with management, and it certainly doesn't go over well with the finance teams. We want to be sure that certainly all of our clients are as lily white as possible with respect to their use of not just the HHS funds, but also the PPP funds, which you'll hear about from Jeff. So let's get into, again, many of you that have seen me before know that I like to get involved in some educated speculation related to what I think is going to happen in the future. I have no particular, if you will, line of sight or line of communication with either state government or the federal government that allows me to predict what might happen over the course of the next 90 days to 12 months. But one thing I've learned after 47 years is that government does tend to repeat itself. So if they spent the time back in March to put together the CARES Act, they're going to take that CARES Act and modify it. They're not going to create a whole new document. And I think that's true generally with most government initiatives, whether it be stimulus-related, rate methodology changes, et cetera. So as we go through this next 65 days, 4 days to the election starting tomorrow, I just wanted to portray for you the various options, which are listed in those first 4 bullets. Any one of those options will likely result in what I describe as a mess or confusion in the marketplace in New York because there will be so many different variables and so many different state and county agencies as well as federal input into what will occur in the new stimulus bill and clarifications of what has already occurred with respect to PPP and HHS funding. As it relates to the Pelosi strategy from a distance, I should have included Governor Cuomo in this as well. He's been playing what I consider to be a very well-played poker game with the federal government, and I'm hopeful that he's going to be successful. Obviously, if Biden wins, the Democrats take the Senate, and Pelosi is still as House Speaker, we have the Senate Majority Leader in Schumer, we have Biden as a Democrat, and New York as a result of Schumer, and California as a result of Pelosi's home state, will be in a unique position to, if you will, take care of the states, particularly the blue states, that have not been taken care of as much in this first 8 months of the pandemic. So, as I will say a couple times here in this time I have remaining, I predict, and this is where I will say the last vote is very important, I am never in the room where it happens. For those of you who have seen Hamilton, you'll know what I mean. But I believe that this prediction of a need for $50 billion from the next stimulus bill for New York State and its counties will substantially change your stress level, your overall anxiety, and your outlook for 2021. Having said that, $50 billion is not going to go very far in terms of the calendar, so you need to be aware that post-stimulus, without a vaccine or without an end in sight for the pandemic, this next stimulus bill gives us a bit of a boost, but it does not result in any way or shape or form in complacency on the part of any of the organizations represented here today. So, all of you have been benefited in some way by some form of stimulus, whether it be the Provider Relief Fund, PPP, the other items that are listed on the COVID-19 matrix that we put together. It's been a tremendous effort on the part of government to make sure that, as best as possible, continuation of charitable services, particularly in the health and human service arena, could continue to provide high-quality services in as safe an environment as possible. The bullets on this slide, I think, are important, again, more for your board than they are for you. I think all of you probably know these things already. If you want to be in a fiscally viable and sustainable basis for the long term, and when I say long term now, it used to be 10 years, now it's 5 years because of all the uncertainty that we have currently. But the position that I believe is most appropriate, and again, this is not shared by all of my Bonadio colleagues, so there are different accountants who have different views. For purposes of maintaining autonomy over the long term, you either need to have or you need to have a plan to have set aside investment reserves that ideally would cover 1 year's worth of your operating expenditures, excluding depreciation. And ideally, you'd like to have a debt service requirement that is less than 2% of revenue. It's been proven to bankers for decades that when debt service requirements, principal and interest on long-term debt, exceeds 5% of revenue, that generally indicates difficulty on a going forward basis from the standpoint of cash flow and financial liability. Obviously, there are exceptions to that. Percentages can be very, very confusing and can be manipulated in many different ways. But again, I think it's always helpful to provide management and board with some of those, if you will, checks on where are we in relationship to others in our service sector. We are living in a world of unprecedented low interest rates. Those of you that have variable interest rate loans, I believe at this point, everybody that can is refinancing their home mortgage. I think that it would be wise for you to look at your debt obligations as well from the standpoint of refinancing if you are on a variable rate document at this point. The Fed is continually saying they can control interest rates through 2023 and 24. I am not an economist, but if they can do that, I'd like to know why they didn't do that back in the early 70s when you could get a certificate of deposit for 17% interest at a bank, and they would love to take your money at 17% interest when the prime rate hit 21%. So let's see how they play out here. We're reliant on the reliability of the entire world to basically honor the U.S. dollar as the continued reserve currency. And if there is some blip in that position that's occurred essentially since post-World War II, we want to be in a position to anticipate, and cash preservation and cash accumulation, in our view, is a key element of your future for purposes of sustainability, viability, and in some cases, survival. So I want to just talk a little bit here about the banks that we have talked to, and we've obviously, through PPP, Main Street Lending Program, and several others, we've talked with a number of bankers around the New York State over the course of the last 8 months. They are all, I would say, understandably concerned, and some of them are a bit skittish or more skittish than others. So your relationship with your banker should be high on your priority list. I would strongly suggest that if you haven't, you should establish either monthly or quarterly calls with your primary banking officer and make sure that you are proactive in the information you provide to that individual. They do not like reactive information that comes late in the game that they feel they should have received earlier on. In the second half of this slide, we have everyone in this group of bullets. We have representation here from our over 400 participants, and so we're going to try to not laser in on any particular funding source, to talk more about, in general terms, the New York State budget as it currently stands and where we're going or where we think we're going into 21-22. And I know that you all feel the pressure and strain of delays either in payments or withholds on state contracts, expenses being incurred without being able to generate revenue, etc. I'm not going to read this slide to you, but I do believe it would be appropriate for your board leadership to know this information. The last number I heard, the highest number I heard from Governor Cuomo was $78 billion. I don't think he'll get what he asked for. We rarely get it that way in our provider appeals to government funding sources. So the $50 billion is an arbitrary number that I've selected on the basis that he expects there to be a $15 billion budget deficit for this year. He's got to close that. So you take the $50 billion, you take off $15 billion, that leaves them with $35 billion to, if you will, shore up those various provider funding sources that were on the previous slide. And if it's more than $50 billion, I think you'll feel a lot better. If it's much less than $50 billion, I think the minimal amount to get us through the next 6 to 8 months will likely be $30 billion. So watch closely that next stimulus bill, if you will, with respect to the amount of money that's allocated to New York State. So $15 billion, second bullet, $5 billion has been already incurred with respect to COVID-19 and not anticipated in the budget. Obviously, with the recent spikes in cases and positive tests, that number is going to increase, and that number obviously will also increase the overall state budget. So all of you know this. All of you need to do as much as you can on the advocacy side to make sure that Senator Schumer, particularly, because he could be the guy, he could be Mitch McConnell for the next 4 years. And let's hope he does a little bit different than Mitch in terms of partisan, or if you will, being more bipartisan than partisan. And I believe that relationships with, obviously, your state senators, your assembly person, is going to be extremely important relative to when this money is, in fact, allocated. There will be a feeding frenzy, and there are far more people out there looking for funding than there will be dollars available. So I think that's very, very important for you to start that process now. Do not wait until either after the election or after the inauguration. Hopefully you've been doing it over the course of the last 8 months. So Governor Cuomo had some remarkable flexibility in the quarterly recess to the state budget, and we will see, I think, based upon the election results, he'll be in a pretty good position to do another reset as of December 31 or in early January. And keep in mind, at the same time, December, January is when he releases his own budget, and it goes through the filter, if you will, of the legislature. So the end of December and January will be very important times, even before we get to the next stimulus. If it does occur, as some people say, it might likely take until early February before we can get to the next stimulus bill. On this particular slide, I just want to remind everybody that the PPS DSRIP program, that's the Medicaid reform program that ended on March 31 of this year. They are in what I refer to as an extension year for purposes of distribution of funds. Many of you have received significant dollars from DSRIP PPS. Others have received less more paltry amounts. But your board needs to understand that DSRIP has been, for many organizations, a support or a lifeline for you in terms of supplemental funding that will not likely recur in 21, 22, or future years. However, I believe that if Governor Cuomo gets his $50 billion or more, he would be very wise to allocate a significant amount of those dollars to the continuation of the activities that have been initiated by the 25 PPSs around New York State. And I do believe that that would be best for all of you as providers, as well as our continued goal of trying to create the most integrated health and human service delivery system in the country, which we have been working on, I might add, since I joined Arthur Andersen in 1973. So I have a little bit of cautious optimism with respect to whether I'll see it in my lifetime. So in addition to the quarterly resets, we've got the Medicaid redesign team, which came out with their recommendations back in the last week of March. You're going to see another set of MRT recommendations for this coming year's budget. And as you know, last year it was Governor Cuomo said, give me $2.5 billion that I can rely on for cut purposes. I think the number this year for the next year's budget, first of all, he needs to get them going earlier than February or March. But I believe that once that MRT or whatever he decides to call the organization or the structure, I believe that they're going to be somewhere between 5 and 10 billion of cuts that they are going to be looking for. You already know Governor Cuomo has indicated that Medicaid service providers should be prepared for up to 20% cuts. And as you see on the last bullet of this slide, we all know that many providers will implode or in the course of imploding, file bankruptcy, be forced to affiliate with another organization, or be carved up by the state of New York if those cuts exceed 2 to 3%. So your budget projections for calendar year 2021, and those of you that are on a fiscal June year end, obviously we say a little bit later on here, we want you to be sure that you're looking out always on a 12-month rolling average. 15 months is even better, as you'll see on some of the slides coming up. Again, I'm not going to review this because our subject matter experts are going to be going into much of what is displayed here in terms of current status. You remember that first slide, confusion abounds, challenges, changes will continue to occur. I've talked about the Pelosi-Mnuchin negotiations. It's interesting that President Trump, if he's still in the mix, is up close to $2 trillion in terms of approval. But I think most of you know, but your board should know, that the House did pass a fairly, what I would consider to be not fairly, generous bill for stimulus of $3.3 trillion back on Memorial Day weekend, or Memorial Day, or that week. So I think we're going to end up somewhere in north of $2 trillion, depending upon the outcome of the election, and it may be $2 trillion or more, regardless of who wins the White House. So, to your board members, I'd like you to use my metaphor here. We've been through 8 months of a pandemic hurricane, and those of you that are in management supervisory positions have had to experience daily tornadoes, multiple in some cases on the same day. And those tornadoes have made for a the most difficult management time frame in the entire part of my career. So I do feel that board members need to understand that the smaller the organization, the more pressure is put on the management team relative to the uncertainty of the hurricane as well as the impact of those daily tornadoes. And it is for these following 4 reasons, not just these 4, but for these 4 reasons that I believe every organization needs to evaluate its future autonomy, ability to either affiliate or merge or connect with a regional group of providers. The technology sophistication and the incremental costs associated with that will be unaffordable since most of you are going to be using your government funding for non-technological purposes. Labor, salaries and wages are 75% of most of your total expenses in hospitals and health systems. The number is usually in the 60 to 65% range. So pretty much everybody on this call has obviously the majority of their costs going into salaries and benefits. I've mentioned the board several times. I've also mentioned management. Board and management leadership is incredibly important. And unfortunately, the generations behind baby boomers like myself do not have the same time or level of interest in making volunteer commitments that perhaps the baby boom generation may have been willing to do. I am the father of 2 millennials, 135, 136. I do not see them, even though they grew up in our household, being all that active in their volunteer commitments because they're relatively stressed out by their daily activities, both of which are in healthcare, I might add, as frontline workers. Telehealth, telemedicine, and artificial intelligence. Jeff might make another comment about AI as it relates to the public accounting profession a little later on, but I'm being benefited by being at the end of my career. What I've heard about artificial intelligence and the impact on our industry as well as many others scares me, quite frankly. And I'm glad I'm on the tail end of my career. I still feel as though I can be valuable in that environment, but it's coming sooner than we might have thought. The economist here at the Center for Governmental Research in Rochester basically said that the pandemic had accelerated many activities, but none more so than telehealth and telemedicine. He believes that just as a result of the last 8 months, we are now 10 years forward, 2030, which is where we would have been had there not been a pandemic. It would have been a very slow and steady crawl for the acceptance of telehealth and telemedicine, and as well, having a meeting like this, socially distanced with 400 to 500 people through technology. And then finally, without question, in addition to the financial concerns that I've talked about, the ability to hire qualified workforce, train them effectively, and retain them, and the more entities that we have competing with one another in the nonprofit sector, the more difficult it is going to be for us to address that particular issue. So all of you need to address many factors that impact on your organization, but I think it's very important for you to realize that those 4 should be front and central, if you will, with respect to your strategies, goals, objectives, and strategic planning. These next set of slides about challenges for providers, I'm going to go through them very quickly because much of it I've already mentioned. Again, they're in here for you to use in whatever form you want with respect to communication with your board leadership, your management team. One of the things that is critical to success in the long term for a nonprofit organization is acknowledgement and awareness. You have to be aware of what's going on around you. If you are isolated and insulated and you think that you have no impact as a result of your geographic location or whatever might impact you in that way, keep in mind that we are now in a global economy, and you also know that in the nonprofit sector we are in the midst of national consolidation as well as state consolidation that I refer to as Amazonification or Walmarting of the nonprofit sector. You can't ignore it no matter who you are. So as I put the materials together for my presentation, I thought we were going to end up with a lame duck stimulus bill, but as of the last few days, it sounds as though it's going to be more likely to be late January or February, and that all depends upon the transition of leadership if something is needed to happen. Jeff Paley is going to talk about the PPP and the Flexibility Act, the extension of the loan forgiveness period from 8 weeks to 24 weeks. And just keep in mind, this next stimulus bill may have additional provisions in it that may favor or be negative for those of you that are going through either the 8-week forgiveness or the 24-week forgiveness. But that's currently an unknown as to one, whether it's going to happen, and two, what the impact might be. The last two bullets is just a reminder to those of you that did use the alternative size standards for purposes of your PPP loan and have more than 500 employees. You and your board should both understand there is a risk with none of that loan being eligible for forgiveness, and we still haven't gotten rock solid black and white clarity on that particular issue, but I do believe that's going to be clarified in the next stimulus bill. In this particular situation, for those of you that are OPWDD providers, obviously we have gone through some substantial cuts over the last 7 or 8 years. Terry will talk a little bit more about reporting with respect to CFRs for OPW, OMH, OASIS, and SED in his presentation, and I think that will be very helpful for all of you to know what he has learned in the course of the last week. And you all know that we're subjected on the OPW side to the revisions in rates that took place, or the revision in regulations that took place as of October 1. So I was optimistic here when I said the impact of the pandemic has leveled off in New York State. I think Governor Cuomo, as long as he continues his diligence and discipline that he's shown since April, we will have better results in New York than we may have in the rest of the country, but it will still have significant impact on providers, not just in the OPW area. This slide is intended for you to read as an intro to what Margaret Lally is going to describe as to the current status of HHS provider relief funding. There was massive communication starting in early April when HHS wanted to get money out to providers. They took the 2018 cost reports, looked at Medicare revenue, and that started what I consider to be a significant amount of confusion and misunderstanding with respect to how to access provider relief fund payments. And if you read this, it gives you the sequence up until recently when I think Margaret has additional information that's been coming out from HHS with respect to reporting requirements. Just want to make one comment. The Main Street Lending Program, if any of you have been successful or are being frustrated by the Main Street Lending Program, we'd like to hear from you. There are some provisions of that loan application that are detrimental to making people that should be eligible not eligible. And I'd like to get as many examples as possible so we can contact Senator Schumer, Senator Gillibrand directly, because if we do have until February for this stimulus bill, this Main Street Lending Program has to be made more accommodating to the organizations, particularly New York City Metro. Those of you that are in the metro area know that your receivables have skyrocketed, your cash flow has gone in the tank, and we need to have some bridge financing from the Main Street Lending Program in order for banks to be able to take on that responsibility. I mentioned in there as well the 15-month requirement for purposes of cash flow and looking forward. The complexity of the accounting for all of this, which you're going to hear more about in a few minutes, is really amazing to me. So keep in mind that whoever you are using as your outside advisors, consultants, accountants, lawyers, make sure that they are knowledgeable with respect to the multitude of complexity that exists in these various stimulus packages. For those of you who are in OPW providers, I want everybody to know that on August 1st of 2020, DOH effectively gave up on their intention of including people in skilled nursing facilities as being enrolled in managed care plans. So it was not widely publicized, and I want everybody to know that this does have a potential impact on residential and long-term care supports and services as OPW moves into managed care. Some of the same things could be applicable in the OMH and OASIS arena, but certainly a significant issue for OPW. Basically, any individual that goes into a nursing home that's deemed to be there for longer than 90 days is being disenrolled from the managed long-term care plan, and that process, as you see, has been occurring since August 1st. I want to just make one quick comment on value-based payments, or what the new terminology. I think I've gone through 10 or 12 acronyms in my career related to basically what was shared savings or pay for performance back in the 70s. VBP is now becoming more commonly referred to as APM, alternative payment methodologies. I think most folks realize that VBP at its core is a race to the bottom and not necessarily a positive for providers. It's a better result for insurance companies and controlling costs than it is for providers to be able to continue to provide high-quality services cost efficiently. And these structures that I refer to here, we are going through a process that I believe will result in a situation where we are going to be more integrated in the next 5 years than we are today, and I'm hoping that that integration can take place in a collaborative mode versus a competitive mode. If anybody had asked me 10 years ago whether or not every hospital in the state of New York would be affiliated with one of 25 performing provider systems, I would have bet my net worth that that would never happen. But that is what happened, and it didn't happen 10 years ago. It happened 5 years ago with the implementation of DSRIP. Now, I realize that's Medicaid, but Medicare is not too far away from a similar structure, and I believe the next administration, if Biden wins, we are going to see what he refers to as the public health option alongside what has been created by Medicare, Medicaid, and the Affordable Care Act. For timeline purposes for OPW, we've been talking about it since 2008. That was after we talked about it in the early 90s for the better part of 4 years. We were going to bring in ResCare to take over the entire state's obligation for IDD back in the 90s. We're now basically in a fight over whether or not providers should have a leadership role in the managed care process, or whether we're going to turn it over to Article 44 insurance companies. I'm hopeful that it can be a collaborative effort, but I do believe we're pushed out now into late 22 or early 23 before anything substantive is going to be able to be implemented. I'm a little short on time here, so I'll just leave these opportunities for growth as examples of what you may want to consider. It's not all negative. There are silver linings in this cloud of the pandemic, and we don't want to negatively or view negatively everything that's out there, and we don't want to become insulated from the world. So we want to make sure that we are aware of the potential impacts that could be beneficial to our organization in terms of growth. One of them, which I mentioned on the first bullet of this slide, affiliations and collaborations. There has been some discussion, I won't mention who, that the state of New York would like to have their contracted providers have at least $25 million of revenue north of Westchester County because of their staff shortages in terms of the ability to oversee the number that are out there that are less than 25 million. North of Westchester, 25 million. Down in the metro area, depending upon who you talk to, it's 50 million or 75 million. So you can look at your particular organization, understand that you do have the potential to be successful as you go forward here, but it has to be a proactive approach, not a reactive approach. And then I don't want to bore you with the details. I think you all know that I've said this many times before. You want to avoid bankruptcy other than what's called a structured bankruptcy, which I think would be very appropriate for many organizations that are going through potential mergers or affiliations. Obviously you've seen significant increase in bankruptcies in the other industry sectors in the U.S. And I think I've mentioned everything else on here. I do want to put the bullet down there because I know we have some smaller providers on the phone who are probably shooting darts at their screen at me. There are exceptions to these arbitrary revenue targets of 25 and 50 million. And there are many, literally hundreds, if not thousands of organizations that I describe as grassroots and volunteer supported that do not have the same impact as traditional program service providers. I will remind you now to submit any questions through the chat function to the all panelists. And again, what I'd like to do is turn it over to Jeff Paley for his presentation. And then after Jeff's presentation, if we have some questions that we can answer quickly, we will. But we really want to get through the presentations. And of course, I went over as everybody in Bonadio predicted I would. Thank you very much.
Ladies and gentlemen, good afternoon. Thank you so much for being with us. Don't worry about our Jerry saying that he went over time. We're fine on time. We're going to get through things, and we're going to have meaningful discussion about each of these topics. So thank you for your time. Let's see here.
Page up. Yeah.
Page up.
Oh, page up. Here we go.
There you go.
Thank you. So we built this session as talking about the new stimulus package, and let that be a lesson to you that auditors and advisors can be optimists. However, that package did not come through, so we're not going to talk about that. I'm sorry to open with a disappointing statement, but we simply just can't talk about that. We are going to talk about PPP, and there's a lot to talk about. We're basically at the end of week 24, or just past that for most people, and there's certainly some interesting elements of this to talk about. Let's start with the basics. Hopefully you're all familiar with the basics at this point. It was created in March, and I won't read these to you, but the one thing that I want to point out on here is that the CARES Act provided significant protection to the lender. And what we mean by protection is, from a legal standpoint, if something goes wrong with one of these loans, whatever that something might be, the lender really has protection legally from any liability related to that happening. And what that means is that the borrower really has all the risk associated with these loans. So we're going to talk today about the PPP program, not from the context of the most frequently asked questions or some of the things that come up in terms of questions related to calculating your forgiveness and things. In this next few minutes here, we're going to talk about the most frequent risk items, the things that present the most risk to the borrower, and we're going to go through those. And there's really a couple things that come up that bubble to the top. If we look at the risk profile again, the purpose of and I want to apologize in advance to our friends on the call who are from the banking community. We have the bankers did not purposely try to arrange this to reduce their liability. It was really Congress saying, I want to get this cash into the economy as quickly as possible, and I don't want bank compliance and risk management folks slowing that down. So basically they said, don't worry about all of that, banking community, just get this money out. So legally, they were absolved, if you will, from a lot of the responsibilities that they might normally have when issuing SBA-backed loans, and it was really in the name of speed. But the long-term consequences, now that we're 6 or 8 months down the road, is that if something's wrong with your loan, it's on the borrower at this point. So please keep that in mind. As we talk about risk, let's think about where we are right now. 24 weeks is up for most, has expired for most folks. So you're either earned your forgiveness or not by now. And the real risk, even though most of the focus of people's time is on the forgiveness calculation and how do you make sure you maximize your forgiveness in terms of the numbers and crunching the data, for most organizations, spending all the money in 24 weeks was not really a problem. So that's not really the risk element that we're going to focus on right now, or the data crunching. What we're really going to talk about is the larger risks, and the first one is eligibility. So the biggest question that comes up related to your risk as a borrower on PPP is about, are you really eligible for this program in the first place? Now, we're working with hundreds literally, of PPP borrowers, and many of them say, well, what do you mean, am I eligible? I got this loan back in April, asking if I'm eligible now, it's kind of too late, right? Well, that's not true. I really believe, and we have seen numerous cases in the not-for-profit community of organizations where the eligibility question is very much relevant as they prepare for their forgiveness application. So early on, we had some high-profile examples of loans that were deemed inappropriate under the program. I want to be clear here to differentiate between inappropriate or appropriate versus eligible under the technical rules of the program. So we're not making a judgment about, are these loans appropriate for you? We're asking you to consider, do you actually meet the eligibility rules? Or maybe you don't, because there are some specific eligibility criteria that were required in order to participate in the PPP program. At the beginning, there was a lot of confusion. As any of you who are involved in this understand, in April, the focus was on speed of getting this cash out. There was a lot of confusion, daily changes to the rules, and really, for everyone, not the bankers and the borrowers, changes happening all the time. It's no surprise that loans happened that probably shouldn't have happened. In fact, there was this sort of amnesty program where you could actually, if you felt like you were not eligible, in the early days, you could actually pay the loan back in May and have kind of a no harm, no foul kind of approach to that. However, if you didn't do that, and now you're thinking about applying for forgiveness, and most lenders have opened up their portals to accept forgiveness applications at this point, we recommend that you go back and just refresh your thoughts on eligibility and document that as though you had documented it back in April. Maybe you didn't back then. We're seeing a lot of folks who maybe didn't. But really, there's 5 key things that you want to think about if in the context of eligibility for PPP. If you have more than 500 employees, you have to document how you could be eligible. Because rule of thumb-wise, to be eligible as a small business for this program, you have to have fewer than 500 employees. If you have affiliates, and as a group, there are over 500 employees, even if individually the various companies have fewer than 500, you really have to think about that too. This is a challenge in the SBA rule. Only certain types of nonprofits were eligible for this. So if you are not a 501c3, a 501c19, or certain tribal organizations, you really have to think about why do I have this loan? You really are technically not eligible. Then organizations that are controlled, and I put that in quotes, by a governmental unit. We know there are 501c3s who have relationships with state and local governmental organizations. Does that demonstrate control? We're going to talk about that a little bit. And then the one is if you claim the employee retention credit, you cannot have a PPP loan or vice versa. So if you did both of those things, there's definitely an issue in terms of your forgiveness application. So the recommendation here is even if none of these things ring familiar to you or seem like they might apply to you, we still think it's worthwhile to go back and document your eligibility. And you can really do that by going back to the application you filled out in April. You certified, whoever signed that application certified certain things on that application to be true, documenting how you arrived at the conclusion that you can legitimately certify those things is worthwhile in terms of understanding the documentation. So let's talk about eligibility. Again, the number one risk, and we call it the number one risk because if in fact you're not eligible, you will not get forgiveness, and you may actually be penalized for claiming benefits under a federal program when you weren't eligible for them. So a couple of the challenges, and this is what we're seeing in practice with the non-for-profits we're working with, the affiliation rules are not the same as what you typically think of as affiliation rules. A lot of organizations are organized in a multi-entity structure where they have been organized specifically from a governance standpoint and a corporate existence standpoint to avoid being consolidated for financial reporting purposes. The SBA's affiliation rules are totally different than those rules. So if you've been specifically organized to avoid or for some specific financial reporting purpose, the SBA's rules don't care about any of that. Quite frankly, they're based on a totally different set of criteria. The other thing that makes this a little bit awkward is all the SBA's rules are based on for-profit terminology and for-profit sort of thinking, if you will. So it can be really awkward to fit nonprofit relationships into those rules, and there's interpretation that has to be made there. It's not always clear how you define the relationships between nonprofits in the context of the SBA's rules. I think Jerry mentioned this alternative eligibility options. Are they available for nonprofits? And there's a lot of hope that we will have some more clarity on that. But if you're going to apply for forgiveness before that clarity comes out, you run the risk that those alternative eligibility options are not available. So we want to, we're recommending in those circumstances that you wait. This other one, this is the most common thing that makes us worry when we're talking to an organization and we say, well, did you document your eligibility? Are you sure you're eligible? And they say, well, back in April, the bank said we were okay. That really does not help you in many respects. And I mean, certainly, I don't want to mean any disrespect to our banking friends who are, I'm sure, on the call. But really, at that time, it was really hard for someone to conclusively say you're eligible if there were questions about the eligibility. So simply saying, well, on April 10th, the bank said we were okay, a lot of stuff has happened since April 10th that might change that answer or that would clarify the decision-making you would have around that particular question. So leaning on the bank said we were okay is not adequate, at least in our view. The other thing, too, is if you have questionable eligibility and you then apply for forgiveness, you may be compounding the problem because now you've filed another form, another application for governmental benefits that you may not be eligible for, and that's something you want to try to avoid. So we're definitely recommending to put off the application for forgiveness for a while. You have plenty of time, there's no rush, to clarify your eligibility questions first, and then move forward with the forgiveness application if that's what makes sense to do. So let's talk about these specifically. Eligibility, meeting the definition of a small business. The CARES Act said if you have under 500 employees, you meet the definition. However, there are organizations who have more than 500 employees who got PPP loans. Well, how can that be? There are industry codes, you've probably seen the list, that the SBA has specifically defined in each of these industries the limit of employees to be considered a small business might be greater than 500. If you can document that your organization fits into one of those industries, you might still be eligible even if you have more than 500 employees. However, if you don't document anything about that, this is going to raise questions when you apply for forgiveness. Or, at a minimum, it'll raise questions when the SBA comes in and reviews this loan later, as they have promised they will do with every loan over $2 million, and they have reserved the option to review any ones that are under $2 million. So certainly thinking about that. Now, compounding that, the complications of that problem is you have to apply the SBA's affiliation rules, which means that if you have a group of companies and they're all affiliated with each other, each one may individually be under 500, but if the collective total is over 500, this is going to raise a question. And we know we're working with organizations right now who have multiple entities within a family of companies. Each one applied with a different lender, and each one got their own PPP loan because they're each under 500, but in total they're well over 500. And now there's this question of how does that work in the context of the SBA's affiliation rules? If this sounds familiar to you, you really have to think about documenting your eligibility or considering what the risks are associated with your eligibility being challenged later if there was a review by the SBA. As far as prohibited organizations, the key one here that we're bumping into is the third bullet there where it says organizations that are owned or controlled by a state or local government. There are 501c3s in New York who have a real relationship to a state or local government organization, whether that be county government, a SUNY system campus, or some, I mean, there's all kinds of organizations that have relationships with state and local government organizations in New York. If you're one of those, documenting the control elements in the context of the SBA's rules is important before you go for forgiveness for your PPP loan. And then this was really clear. The CARES Act is very clear. You have to be if you're a nonprofit and you want a PPP loan and if you want to be eligible, you have to be a 501c3, 501c19, or certain types of tribal organizations. If you're a 501c6, for example, you're not eligible. This is a challenge because we know and we've seen, and obviously without naming names, organizations that are 501c6s, 501c4s, and other types of 501c organizations who got PPP loans because in the rush and the confusion in April, it just happened. If that's you, we strongly recommend you think about risks before you apply for forgiveness. So that's the eligibility risk. Let's talk about the calculation risk. And really, when we think about the most common issues in the context of risk, there's a few things that pop up. One of them is the payroll providers, the payroll provider community has come out with reports, and I call them canned reports, and I don't mean that to be disrespectful. It's the easiest way to describe them all, where you can log into your payroll provider's website or their service, and you can run reports that give you the data you need to fill out your PPP forgiveness application. We've seen a lot of these reports from a lot of different providers, and we've also seen problems with them, not because the report is bad, but because the user who's going in to run the report runs it on the wrong parameters. So if you are that user, if you're the borrower, and you're having somebody on your team go in and run these reports, it really needs to be reviewed. Did they run it for the right date range? Did they run it for the right criteria? Because we're seeing these reports being given to us for review when we're helping people with their forgiveness application, and the information is just not correct, and it could lead to problems with your forgiveness application. The biggest risk, and at the beginning I think I meant to indicate there were two primary risks. The one is the eligibility that we just talked about. The second one is this concept of the double dip. And this relates to the possibility that your organization may be getting multiple funding streams that are either somehow expense reimbursement funding streams. So the PPP, you get the forgiveness based on, did you spend it on eligible expenditures? You probably have other funding streams that you would, quote, earn based on spending those funding streams on eligible expenditures. That could include the recurring funding that you have paying for your programmatic activities that you have every year, or it could include other things that came out of the CARES Act, including the HHS Provider Relief Fund, where you have to then, at some point, you're going to have to document what you spent those monies on in order to earn the revenue from those funds. And this double dip concept is that if you have a single dollar of expenditure, you can only apply it to one of those funding sources as an eligible expense. If you apply to multiple funding sources and those various funders come in and sort of realize that that's what you're doing, is one of them or multiple going to deny the revenue claim for those expenditures. So this idea that you're going to put all your payroll costs against your PPP loan for forgiveness purposes, but then you're also going to put some of those payroll costs on your CFR in terms of determining rates or reimbursements under your New York State funding streams, this is a question that we do not really have a clear answer to how the state's going to address this question. So in the end, we're not in the end, we're still in the middle, so it's not the end. But at the point we're at now, there's this risk management decision about how much risk do you believe for the state funding streams that you are involved with, that you're going to claim either on a CFR or on a voucher for a contract reimbursement. How much risk is there that the state will say, if you got reimbursed for these expenses through PPP, or through the HHS Provider Relief Funds, or through a FEMA grant, or something else related to the CARES Act, that they're not going to pay? And is that going to affect your reimbursements going forward? We really don't have clear answers on this question, and you'll get theories from folks, but in the end, it's a risk management decision. Most providers are going through an exercise where they're trying to manage the risks by identifying the buckets of funding and what types of costs they can put against each, and then seeing, can they fill up all those buckets without any crossover, any double dipping. So the risk there is when you, especially if you're a December 31 year-end client and you're going to be going into your audit for soon, how much revenue can you record versus how much risk do you have that some of those funds cannot really be earned because you haven't spent them all without double dipping. This is a risk, and that is, to me, one of the two primary risks going on as people are thinking about their PPP forgiveness. Do you have to carve expenses out of your PPP forgiveness because you want to be able to claim them against something else, one of your other funding streams? And then the other one relates to the safe harbors. There's safe harbors within the PPP, and they relate the ones where we're seeing some risk is if you had a reduction in your FTEs during your forgiveness period as compared to the pre-COVID period.
Jeff, advance your slide one more.
Oh, I'm sorry. Sure.
You okay?
If you had a reduction in your FTE as compared to the pre-COVID period, do you qualify to not have to reduce your forgiveness for that because you qualify for one of these safe harbors? And there's really two. One of them is you basically had to shut down part of your operation because of government orders due to COVID, or maybe you reduced your FTEs during the forgiveness period, but you restored them back to the pre-COVID level before the end of 2020. Both of those things carry different risks and different strategies, and it's important that as you think about whether you qualify for either of those, that you think about the risk, think about that from a risk perspective in the context particularly of the one where you're restoring your FTEs. There are organizations who have said, well, I'm just going to hire a bunch of people back for a day, and then I'm going to lay them all off again. And is the SBA going to see through that? Is that going to work? And what risks are there with that kind of strategy? It's an interesting conversation to have. Don't simply just assume that it's as simple as it looks, because unfortunately there's some complications with some of it. So that was a brief run through, and again, our intent was not to go through all the commonly asked questions about PPP, as much as to focus on the key items of risk associated with PPP, and hopefully you have some perspective on some of those things. If there's any questions, please put them in the chat. We will get to them eventually, even if we're not going to get to them at this particular moment. Thanks.
Thanks very much, Jeff. I'm going to turn it over to Margaret Lally for the discussion on HHS and the provider relief funds. I believe that in addition to the PPP presentation you just heard, we likely are going to receive just as many questions, if not more, with respect to the provider relief fund, because it has been, and Margaret will certainly be able to describe for you, a roller coaster ride from the early part of April to today, and that roller coaster ride might continue for the next 3 to 6 months. So with that, I'll turn it over to Margaret. Thank you, Margaret.
Thank you so much. All right.
Shan?
Yep, she's on. She's on.
Okay, you should be good.
There we go. Okay. So as part of the CARES Act that was signed back in March, HHS created a $175 billion provider relief fund that was intended to address economic harm. Healthcare providers have faced this kind of triple whammy of issues, given that a lot of the non-emergent care has been put off by people. But at the same time, you know, your expenses have increased substantially due to COVID. And on top of that, the uninsured population has increased. So really, I think HHS knew that we had to maintain delivery capacity in order to handle the coronavirus, but that was going to require a major infusion of cash. So the one thing that they've done really great at is getting the money out quick. The reporting requirements, the eligibility, all of these kind of questions have not been quite as, they weren't prepared for it, which, you know, I don't know that you can fault them for that, given that it's such a unprecedented event. But in any case, information continues to come in, and in fact, they just released a new batch of FAQs just maybe yesterday. And so I would definitely encourage everybody to make sure that you're checking that website frequently. And if you don't have the time for that, you can certainly engage somebody to do that. I'm sure many of you have been receiving email blasts from us, and those I'm sure will continue. But the overall focus of this plan and intention is for the money to go to providers who provided diagnosis, testing, or care for actual or possible COVID-19 patients after January of 2020. Now, the catch here is that HHS broadly considers every person a possible COVID patient. And that makes sense because, you know, whether or not you have a case in your facility, you still have to take these precautions, and that involves a cost. So the payments can be used to prevent, prepare for, or respond to the coronavirus. And it has to be expenses or lost revenues that are not reimbursed by another source. So I think, you know, later on we're going to kind of get into the weeds of, you know, detailed reporting requirements. But I think sometimes when you're thinking about whether something's allowable or not, it's good to kind of go back to these overarching intentions of the program and see if the expenses or lost revenues that you're thinking about, you know, fit within that intent. Okay. So this provides kind of an overview of the phases that have been released so far. We had 2 general distributions back in April, May, June, and July timeframe. As Arch said earlier, that first distribution was based on Medicare revenue, and that was because they had that information readily available and so they could push that money out quickly. Then there was an opportunity for providers to apply for a payment that was the balance of 2% of their total revenue. Now, a lot of you may have remembered that shortly after the June 3rd deadline for that portal, they came out with a Medicaid fund. And initially, the rule said that if you had gotten anything from the Medicare piece, no matter how small, you were ineligible for this Medicaid distribution. Obviously, there was a lot of uproar. You know, the requirements weren't communicated very well. And so there was a lot of advocacy and outreach, and they actually changed the rules and expanded eligibility to include anyone who hadn't gotten that 2% already. Now, I mention this because HHS has been extremely responsive to provider feedback, to advocacy from associations as well as Congress people. And so if you're coming up with a problem that's unique to you or affects your whole industry, it's definitely worth the time to advocate and to reach out to your representatives. So those first 2 distributions closed in September. Then in the middle section, you can see there were targeted distributions. HHS realized that certain providers really needed extra help. So they gave more money to hospitals that had really high levels of COVID admission. They gave money to rural hospitals that are having difficulty, you know, really thin margins, and this reduction in revenue really hit them hard. So those were kind of targeted distributions that they sent out. Now, most recently, they've announced a phase 3 general distribution. This distribution, first, it kind of has 2 pieces to it. So first, they're going to give everybody who hasn't yet gotten 2%, they're going to give them that 2%. Now, this counts whether maybe you got money earlier and you rejected it, and now you would like it. You can feel free to apply for that. They've also expanded eligibility to some behavioral health providers that weren't included before, maybe behavioral health providers that only service commercial insurance or private pay patients. They are now eligible as well. And if you go on the Provider Relief Fund website, there's a very long list. I couldn't begin to name them all off here. But essentially, if you've provided healthcare services, it's definitely worth it to apply. Now, the second piece of this phase is a potential for an add-on payment for providers who have already received that 2%. So they're collecting a little extra information in this phase. It uses the exact same portal as the phase 2 general distribution. So for any of you who did that distribution, it's going to look very familiar to you. The same link. The only wrinkle is that none of the information from prior applications is going to carry forward. So things like your TIN validation, the name of your facility, that kind of thing, you're going to have to fill out again. They're also going to ask you for patient service-related revenue and expense for both Q1 and Q2 of 2019 and 2020. Now, just yesterday, they clarified they don't know exactly what the calculation of the payment is going to be. because a lot of it depends on how many people apply. So first, they're going to take the $20 billion that's allocated to this phase and give any providers that didn't yet get that 2%, their 2%. They get first dibs at this money. Whatever money is left, they're going to look at everybody's change in net income from those first 2 quarters and proportionately distribute it. So again, without knowing exactly who's applied, they're not going to be able to tell you exactly how much you can get. And, you know, given that the calculation isn't set in stone yet, I would definitely encourage everyone to apply. There's really no risk in applying. But, you know, given how frequently the rules change, you'd hate to not apply and then have something change and realize that you've missed out on an opportunity. So more recently, they've released guidelines for the use of funds. As I said, a lot of the new FAQs deal with this as well and kind of clarify some of these things, but it still is very much in flux. I know that HHS generally wants to provide a balance between, you know, accounting for the funds and ensuring that there's no fraud and that kind of thing, but also they understand that the last thing that you need during a pandemic is a massive administrative burden. So I think there is going to be a lot of balancing of that. Some of the FAQs that have come out are a little scary in terms of the kind of detail that they may be looking for. So I would encourage everybody, I think, no matter, you know, which program you're involved in, document. You know, you can't document too much. If you don't need it, then, you know, you're prepared, but you'd hate to be in a situation where you're reporting on things and you just don't have that backup. So if these 2 definitions are essentially the 2 buckets that your provider relief funds can be used for. The first bucket is expenses that are attributable to coronavirus that are not reimbursed or obligated to be reimbursed from another source. And that does include insurance and patient payments and funds from state and local governments. HHS also just recently announced that in terms of how the order of funds work, HHS funds should really be kind of the last funds used. I know that a lot of people have said that FEMA generally is the payer of last resort, but it explicitly says in this new FAQ that HHS funds should be used after FEMA funds, state funds, insurance payments, etc. So really the way you want to look at these expenses is how much did it cost you in a pre-COVID world versus how much does it cost you now? So, you know, things like PPE that you didn't have to buy as much before, or maybe because of demand, they're more expensive. Those are the kind of incremental costs we're talking about. Hazard pay for employees, overtime, any kind of, you know, capital improvements that you needed to make to comply with social distancing requirements, increasing your infrastructure to be able to offer remote and telehealth services that you used to provide in person. All of those kind of incremental costs can be attributable to coronavirus and used for provider relief funds as long as they're not reimbursed from someone else. So again, that gets back into the double dip issue. After you've found all of your expenses, that piece needs to be done first. Then you can apply lost revenues to any remaining funds that you haven't spent. So this is another place where advocacy really paid off. In the initial guidance, you know, all of the applications had always asked for lost revenue, and they defined it as the change in revenue year over year, which makes sense. But the first reporting guidance that came out said that they were instead going to look at your net income, your change in net income. So if you did better this year than you did last year, not sure that applies to many people, but if that is the case, then essentially you wouldn't be able to claim any lost revenue. Or if your change in net income was, you know, your loss of net income was less than the expenses in step 1, you wouldn't be able to claim any lost revenue either. There was a big uproar, again, a lot of advocacy, and on October 22nd, they did respond to that and changed it. And they discussed the fact that the idea of using that income was more because they didn't want providers to be better off and more profitable in the COVID world than they were in the prior year. But by rolling back this requirement, they essentially admitted that this will allow some providers to be more profitable this year than they were in the last year, and that now they're okay with that. So this is going to be on your phase 3 application, and this is also kind of guidance for the reporting. So operating revenues from patient care. You know, one thing about this provider relief fund, they're trying to, you know, cover many disparate types of providers with one application process and one reporting process. So depending on what kind of provider you are, some of these terms may not really jive with the kind of programs that you're used to. So patient care, for example, that's a very hospital-oriented term. But really, it's, you know, it's services that are services, support, and healthcare that are provided in a medical setting, at home, or in the community that can be included in this. So you're going to start with your gross charges for healthcare delivery. You're going to take away your contractual allowances, your bad debt, and your charity care. Now, you can include revenue from the 340B program, and you can also include resident fees for assisted living or nursing homes. So that's an area where, you know, a nursing home might not call it patient care, they are assisted living, but they do include those. The things that aren't included in operating revenues from patient care are things like, you know, proceeds from insurance, any retail sales that you might have. Maybe you rent out a portion of your facility to an unrelated entity. That kind of rental income would not be included. Grants, tuition, essentially things that you would generally see in either other operating income or non-operating income. Those are the kinds of things that you want to exclude. Now, operating expenses from patient care, those are definitely your direct costs. I think everyone, you know, can easily identify those. But they are also including expenses that are generally considered part of overhead. So your admin costs, your capital costs, you know, employee benefits, all those kinds of costs are also includable. The kind of costs that you want to exclude are kind of comparable to the income that you want to exclude. So any costs that you have on your rental properties that you rent out and get rental revenue from, you don't want to include those. So here's kind of a flow chart of how you should go through the calculation. You're first going to identify those expenses that are related to coronavirus that are not reimbursable by another party. And then you're going to calculate the change in patient care revenue for between 2020 and 2019. Now, there's one more wrinkle here in terms of the guidance. It's a little unclear at this point. When they changed the lost revenue definition from a change in net income to a change in revenue, initially, when they were looking at net income, they said, we're going to look at the change in net income from 2020 to 2019. And then from that amount, you're going to have to back out the expenses that you identified in step one. Because presumably, if you've already used the healthcare provider relief fund for those expenses, you know, you have been reimbursed. So that shouldn't go towards your loss. They left that language in when they changed the definition of lost revenue. So as it stands at the moment, it tells you that you have to calculate that change in patient care revenue from 2019 to 2020 and then back out the expenses. Now, this really doesn't make sense. As I said, it makes sense to pull out the expenses if you're looking at net income, but not when you're looking at revenue. So I do think this is not an intentional thing by HHS. And in fact, it disadvantages providers who had an increase in lost revenue, but an increase in expense as well. So providers that had a worse net income than they did lost revenue are going to be hurt by this calculation. And that's why I can't see that this is what they're intending, and I think it may be just a wording thing that needs to be updated. So my assumption would be is that the actual calculation will be your expenses from COVID and then your lost revenue, and you can use both. So these are some example calculations. In the top calculation, you look at the change in 2019 and 2020. So their revenue went down by $500,000 and their expense went up by $500,000. So their margin changed by $1 million. Now, let's say they had $500,000 of COVID expenses. Under the old methodology, we would have taken those $500,000 of expenses off of that margin, and you would have resulted in a $500,000 lost revenue allowable. Now, my assumption is, again, that with this new methodology, you will be able to take those $500,000 in COVID expenses and the $500,000 loss in revenue. But as it stands right now, if you take the $500,000 in lost revenue and net that with the expenses, you would come up with a lost revenue figure of 0. I'm hoping that this is going to be clarified soon, and like I said, I think the intent is to add the two. It doesn't make sense not to do that. And again, I think once people start realizing that it hurts, providers that are worse off, I think this will definitely get changed. So in the second example, you can see that this provider also lost $500,000 in revenue, but their expenses went down a little bit. Maybe they had flexed down their staff to accommodate for the fact that there were less people to service. So here again, we have $100,000 of expense, but you can see that $500,000 of expense fully eats up the change in margin and the change in revenue. And so there's no lost revenue for this particular provider. And again, if you have any questions about this, feel free to reach out. We've done a lot of consulting work and always happy to answer questions for people. So as for the reporting requirements, this table kind of shows the level of detail you're going to need to go into. If you received less than $10,000, you're off the hook. There's no reporting required, and you can just keep the money. Unfortunately, I think that doesn't apply to very many providers. So if you've gotten between $10,000 and $500,000, you're going to be subject to aggregated expense reporting. And I'm going to quickly go through what those categories are in the next slide. But really, it's just the top level. There's 2 categories that you have to report, and it should be pretty simple. If you got more than $500,000, there's a more detailed expense reporting that you're going to have to fill out. And then it's good to note, too, that anybody who got more than $750,000 in total federal funds, so HHS plus any other federal funds you may have received, you will be subject to a single audit. And I know that, there's a lot of people who've never had to deal with that before, and I think some of my colleagues are going to be going more into what kind of requirements are involved with that. So for reporting, for the expenses, you're going to have to report by quarter, and they fall into 2 general categories. So if you're under $500,000, you only need to report your general and administrative expenses and your healthcare expenses related to COVID. If you're subject to that more detailed reporting standard, you're going to have to go into more detail. So you're going to have to show your mortgage and your rent, your insurance, lease payments, and the other items that I've enumerated here. It is kind of strange that they included personnel with general and administrative. Again, sometimes the language that they use isn't the kind of language that we're used to using, whether it's for CFR or cost reporting purposes. So it's good to look at it, and it may not make sense in your mind, but you've got to kind of follow the way that they have it laid out here. So these are the expenses that are healthcare related, and these are kind of your incremental costs related to COVID. So your PPE, your hand sanitizer, IT infrastructure expansion, that kind of thing. And I like to think about the healthcare related expenses and the general and administrative kind of like, variable versus fixed costs. So these expenses attributable to coronavirus are kind of more like your variable costs. What's different now with coronavirus than was beforehand? And then HHS also understands that in order to maintain care delivery, there's certain fixed costs that you just can't change. So that's where on the previous slide, things like your mortgage and your, employee benefit costs, insurance, things like that, where your revenues have gone down, but you still have those costs in order to stay operational. So they are allowing you to use those costs as well. So as part of the reporting requirements, they're also going to ask for a lot of other information for data gathering. So I've kind of laid these out here. They're going to ask you for demographic information, and they're going to ask you for your revenue by payer. Laid out in the following categories. They're also going to ask you about other assistance that you've received, so Treasury, SBA, PPP, FEMA funds, state assistance, other grants and revenues. And then they're also going to ask about a bunch of non-financial data. So they have different personnel metrics, how many full-time, part-time, contracted employees you had, patient metrics, things like how many admissions, how many discharges, how many emergency visits, how many resident beds you have, that kind of thing. And they're going to ask about facility metrics, so how many inpatient beds, staff beds you have, that kind of thing. And then there's also questions specific to providers that went through a change in ownership. So it's good to get a handle on all of this so that you're ready and it's not a surprise to you when you go to fill out your reporting portal. So I'm going to finish up here with some key dates. The Phase 3 application that we talked about earlier is due on November 6th, so that's right around the corner. Now, they did clarify today that similar to the Phase 2 application, as long as you've submitted your tax ID number for approval by November 6th, you'll be okay, and then you'll have until November 27th to actually submit the application. So I would encourage you to get your TIN in for validation. That buys you a little time, and then you can complete your application. Now, on January 15th, the reporting portal is going to open for all providers. So that's really not that far off. And you'll have a month to do the reporting. So I think that this Phase 3 application has really been nice for a lot of our clients because it requires you to identify revenues and expenses. It really provides a nice snapshot of where you're at 6 months in. And you can kind of look and see how much money you have left to spend, how much you've fully expended, and then take a look at your other funding streams to see, what you might need to do strategically in order to make sure that you don't have a payback. So again, I would document. Then if you haven't used all your money in 2020, you do have until June 30th of 2021 in order to use it. And then there will be a final reporting period on July 31st that will compare your 2021 numbers back to 2019 again. They also said at this time, they're not going to require any external documentation in the initial portal submission. So no invoices, that kind of thing yet. Although we don't know what the auditing, if they're going to audit people or not. So I definitely think you should hang on to any documentation you have. And they did indicate that you need to retain that documentation for at least 3 years. So that's kind of my report on HHS. Again, I would encourage everybody to check the website frequently because it does change a lot, and sometimes there are extremely material changes.
Thank you, Margaret. I want to keep you on the hot seat here. We've got several dozen questions for you and for Jeff. We're not going to be able to cover all of them, but John Miller is going to ask questions, and then we'll direct them to either you or Jeff, depending upon the nature of the question. The one that I just saw, which I think you can answer very quickly, was which of the two, HHS or FEMA, is the payer of last resort? I think that may have caused some confusion in the comment that you made, and if you could clarify that, that would be good.
According to the HHS FAQ that was just released, providers need to use HHS money after FEMA money. So in terms of the order of usage of funds, HHS should be the last one.
Thank you. You probably just made several people unhappy, but you got to just give them the facts, Margaret. Okay, John, next question.
For Margaret, we have several questions in regards to this Phase 3 distribution. Some folks want to know, can they still apply? What do they need to do to apply? Some did not believe they were eligible or they did not receive their 2% net patient revenue, so can they apply again in Phase 3? So maybe if you could spend a couple minutes talking about on the November 6th application date and what they need to do to apply and where they can find information.
Yep, so the portal is actually the same one as the Phase 2 portal. So same link, it looks exactly the same. The only additional information you're going to need to provide that was different from Phase 2 is your quarterly revenue and expenses for 2019 and 2020 so that they can calculate your change in margin. It's important to know also if you had a Phase 2 application that had not been processed yet, they've cleared those out of the system and you need to reapply through Phase 3. So my recommendation would be if you have not gotten 2%, absolutely apply, because you're covered then. If your Phase 2 application was deleted, if there's any kind of question about the status of it, apply for Phase 3 because they will figure that out, and at least you've covered yourself with a Phase 3 application. So the TIN has to be submitted for validation by November 6th. Once you have done that, HHS will send you an email to let you know whether your tax ID is eligible or not. And once that email comes to you, you'll be able to go back into the portal again and actually submit the application. And again, it's very much the same as the Phase 2 application. So it's asking for some pretty basic identifying information. And then you're going to have to upload your tax return. You're going to have to provide those quarterly revenue and expense information and support for that, which can be internal financial statements. It's nothing, doesn't need to be anything audited. And then you also provide your banking information so that they can directly deposit the payment to you. And again, like I said, I would encourage everyone to apply. I don't think there's any risk in applying, and you might get an add-on payment, or if you haven't gotten that 2%, you'll get that as well. Other thing to be aware of, when you upload your tax return, you're going to want to use the most recently filed one, even if in prior applications you used a different one. So let's say in Phase 2 you uploaded your 2018 tax return because your 2019 one wasn't completed yet. When you apply this time, if your 2019 return is done, you're going to need to upload that. And really, I mean, that can give you an opportunity for an extra payment as well, because if your revenue in 19 was greater than that in 18, you would get 2% of that difference. So again, I would encourage everyone to apply. It's not a horrible process. I think they've worked out a lot of the kinks by now. So same website as before, same portal as before, couple extra pieces of information, and make sure you do it by November 6th.
Thank you, Margaret. John, next question.
All right, another question for Margaret. I think these next two should be very, very simple for you. Our agency needed to purchase an additional vehicle to adhere to social distance. They received funding from the HHS. Is that an acceptable use of funds?
Yes, I would say absolutely. The only question that we would need to look into a little bit, they came out with new guidance, and I haven't looked at it closely enough, is whether you can include the total cost of the vehicle or just the depreciation expense on that vehicle for the year. So I will look into that, get some other experts to look at and see what they think of the wording, and get back to you on that.
And then also to reiterate, we had a couple questions come in concerned about 340B revenue. Is that included in your lost revenue calculation? Yes.
340B revenue is included. However, if you have a private pharmacy on site, say at a hospital or something like that, any kind of private pharmacy revenue is not included, but 340B absolutely included.
Okay, I see much more complex HHS PFR questions that we can address later if there's time, or in follow-up emails. So I'm going to put Jeff on the hot seat related to the payroll protection program. Jeff, as you know, it was an 8-week program, then the option came out for 24 weeks. What does one have to do to be considered for 24 weeks?
Well, the good news here is that you have total flexibility. You can pick, do you want 8 weeks or 24 weeks, and you do not have to tell anyone until you actually submit your forgiveness application. So a lot of organizations are actually running the numbers both ways and trying to figure out, well, which one's most advantageous. And you have the flexibility to do that. So you do not have to do anything to shift from 8 weeks to 24 weeks. both of those options are equally available to every PPP recipient, unless you've already applied for forgiveness, in which case you can only apply once. That would be the end.
And Jeff, from your vantage point, are almost all of our clients expecting to get 90 to 100% of forgiveness at this point? Could you just comment on what the expectations are?
The most common strategy here is that because of the double dip question, the double dip risk, most organizations are selecting the 24-week period because then they have a much larger total pool of expenses from which they can pull out those expenses that are subject them to double dip risk, and still have enough to cover the PPP loan amount. So most organizations strategically going with the 24 weeks and pulling out the double dip risk out of the equation to try to minimize that, and still maintaining 100% forgiveness based on the expenses that are left.
Back to you, John.
Jeff, follow up on that question. Does the 24-week period have to be consecutively, and do you have to use all 24 weeks?
It does have to be consecutive. You have two options at the beginning. You can start the 24-week period on the day you got the loan proceeds, or if you have biweekly or weekly payroll, you can start it on the first day of the next pay period after the day you got the loan proceeds. Those are the only two options for when the period starts. And yes, it does have to be a consecutive number of weeks. There is some flexibility if you believe you got to 100% forgiveness, let's say in 16 weeks or 18 weeks, that you could apply using that shorter period. So you would elect the 24-week period, but you would stop counting at the week where you believe you got to 100%. That is an option, and there's a little bit of complexity there that I don't want to take too much time to get into right now, but that is an option, and it is something worth considering, and it's, again, why a lot of organizations are running multiple scenarios to see which one's most advantageous.
Mm-hmm. And then, Jeff, last question, then I'll have one for Margaret. How long do you believe it will take for the banks and then the SBA to process the forgiveness application?
Well, under the CARES Act, that's actually enshrined in the law. The bank has 60 days to evaluate your application and forward it to the SBA for their consideration, and then the SBA has 90 days after that. And you, under the law, are supposed to hear back from both of those parties within those time frames. Now, is it possible that they won't make it? I don't know. We haven't had enough days yet to know if banks are going to make the 60-day limit. We have not heard of anyone not making the 60-day limit on that. And the SBA's processing time, really, we haven't gotten far enough to get to the end of the 90-day period with anyone. So we anticipate that both of those parties are going to operate within those time frames.
Okay. Margaret, part of the Provider Relief Fund is you apply the expenses, or you use all the sources first to apply expenses. Will you be penalized if you do not apply for FEMA funds and just use the Provider Relief Funds again for your COVID expenses, or are you required to at least apply for FEMA?
I don't believe that you're required to. I think that if you do and get the money, then you need to apply that first. But I don't think there's any requirement that you apply for anything like FEMA or any other kind of grant.
And then for Margaret, and then I'll have the same question for Jeff. What do you believe, as of right now, is going to be the scrutiny or the auditing of the Provider Relief Funds?
Honestly, I'm not sure. They have indicated, like I said, that they're not requiring any outside documentation to be uploaded for the February 15th deadline. But I don't know. I can't imagine that they have enough staff to audit every provider. I don't know if they're going to pick a sample. You definitely want to have everything documented, and you want to have support, and they did indicate that you need to keep it for 3 years. So my assumption would be that there's going to be some oversight, but I do think that they've always kind of tried to balance, the oversight goal with also realizing that putting this ridiculous burden on providers that are already dealing with a pandemic really isn't workable either. So I know that's not a great answer, but hopefully more to come on that.
And Jeff, you mentioned that SBA will be auditing all loans over $2 million. What do you foresee the scrutiny is going to be?
I made two relevant points there. Yes, they have promised to look at all the loans over $2 million, But the SBA, every other SBA loan program requires the lender, the bank, to deal with all the compliance stuff. This is why, one of the reasons why banks have such robust compliance and internal audit departments, that they are responsible for all the compliance elements of these types of programs. However, with PPP, the bank is relieved from all of that responsibility, and therefore the SBA would be the one who would be actually coming in to do these audits or figuring out how to do these audits. But there's two challenges there. One is, because the SBA doesn't do this on any of their other loan programs, they have no staff, no capacity, no infrastructure to do the audits of loans. So we don't know how they're going to execute this. They also have no budget for doing audits of loans, by the way. And then the other thing is, if we have a change in administration, and that affects the go-forward approach to all of this, the vigor with which these audits might be done could be different than it might be under, depending on who's in the administration in 2021. So those are two very large variables that make it really hard to know. But if you have a loan over $2 million, you have to assume that someone's going to look at it at some point, and you should go forward on that basis.
Okay. I got one more for Margaret, because they're coming in and people are just anxious and they want to get the cash.
Go ahead and ask.
Questions related to eligibility. I'm not predicting that I'm going to lose lost revenue. Should I still apply, or am I still eligible?
Like I said, I would go for it. I would apply. I don't think there's any risk in applying. We don't 100% know exactly how they're going to calculate this add-on payment. And if you had anything, if you're not sure if you got that full 2% or if you have a newer tax return, all these things are kind of unknown and difficult to keep track of. So I don't think there's any risk in applying, and you can kind of get all of that stuff flushed through and make sure that you're getting exactly what you're eligible to receive. But there's no penalty if you apply and you're not eligible. You just won't get another payment.
So Jerry Archibald's view is consistent with Margaret, but I'll say it in a little bit stronger way. If there is an open door eligible for your organization to back up a truck, get the biggest truck you can, back it up to that door, and take whatever money they're willing to give you. Obviously, we're not discussing this from the standpoint of robbery or illegal activities. We want to make sure that your ability to get your truck filled up is a legal objective or process. But please, this thing could be going on for quite some time to come, and I believe that preservation and acquisition of cash for purposes of moving through this pandemic is going to be eventually priority one for many of you. The next presentation, which kind of dovetails with the Q&A that we just did, John Miller and Mike Blomer, two of my colleagues, have put together a list of top 10 questions with respect to the CARES Act and PPP, and I'd like to turn it over to them at this point.
All right, I've been the man behind the mic asking the questions. Hey, Joe. All right, so what Mike and I did was we put together a list of the top 10 questions and concerns that we had received through last week. While sitting here, that list is now up to about 50. I can see constant themes. One of the main questions is, will we be getting the slides? Yes, we will be doing a recording and the slides for you to share for the attendees and those that came here. And also, we'll be expanding on some of the more technical questions that we received thus far. But what you can see is the first question that I've received consistently over the last couple of weeks. With the provider relief funds not being clear, the guidance consistently changing, Margaret talked about the lost revenue is changing. What should I be doing today in order to prepare for these provider relief funds, and how do I use them? And I said, my response is extend your culture of compliance to the provider relief funds. Those are federal awards. I'll talk about a little bit later how they are subject to the single audit. So you should be educating your organization on what they are, how they're going to be scrutinized, where the risks are. So not just educating the department heads, everyone on down. Hey, if you're using these funds, charge an expense to it. It's important. This is going to be scrutinized. And then also educating your governance on it as well. We receive X amount of money. It's going to be scrutinized. We might need a single audit with it. One of the items I also talk about is you should delineate the expenses, come up with a separate departmental code for those COVID-related expenses, and then just begin to calculate and develop a baseline lost revenue. Even though we've know it has changed twice in the last 45 days, I believe the FAQ that came out yesterday had a little bit of a clarification, and Margaret mentioned we expect more clarification, but at least get yourself into a cadence of, I'm going to have to calculate lost revenue, I'm going to have to do this quarterly, this is what they're going to be looking for. That way, when it comes time and it's finalized and it's time to report, you're kind of ready to go and you know how to handle it. Next question is, where do I classify salaries for provider and clinical staff related to treatment or preparation for the coronavirus? Margaret talked about this a little bit as well. When you actually look at the use of the provider relief funds, they have healthcare related expenses. And you'll see in there's nothing related to salaries, clinical time and wages. Where does that go? Well, it's under general and administrative. And you'll have to wrap your head around that when provider relief uses general and administrative, it's not like we think in the nonprofit world, health and human service world, that G&A must be general and admin, that's an allocation. What they're just saying is, no, general and admin is your direct charges, your salary charges. You can put those in there and you can code those in to extract the amounts. Do I need a separate general ledger department for each form of COVID-19 assistance? From monitoring the questions, I can see people have PPP, people are talking about FEMA. There's obviously the provider relief funds. I know the Mother Cabrini Foundation came through with funding available. I think the response to this is it depends. What's easiest for you to track those expenses? I ultimately think you should have at least one department code for COVID-related expenses. But if it comes down to, well, we have 6 different grants, and I'm asking people to enter their time into 6 different grants, or each department head has to break out and say, well, gee, where does this extra PP&E go? What grant is this? Maybe it's not the easiest thing. Put it all in, and then you can segregate it later on the back end. Where do I recognize unspent COVID assistance funds on the balance sheet? I saw this question come through a couple of times related to financial reporting, especially as we're getting to 12/31. So to the extent you have provider relief funds that you did not have eligible expenses or lost revenue, those would be recognized as a deferred revenue or due to third-party payer. It would be on your balance sheet as a liability. So you have the cash in, but you haven't recognized the revenue with it. And the other question I've been receiving is, how do I allocate overhead costs to COVID-related expenses? Remember what I said earlier, that you have this G&A column. You're putting salaries, you're putting direct items, expenses in there. If you look down, you'll see there's actually a place for overhead costs to be allocated. We do not see in the guidance right now actual explanations for this is how general and overhead should be coded. What I would say is look at your funding source. Use reasonable methods. Document what you're doing. Document your allocation methods. The other thing I would also say too is remember, there might be somebody, because of the pandemic, that is typically a G&A employee. They might be providing now direct services related to COVID. I've had a couple of cases where people have gotten outside the finance office and started doing something directly related to it. The other thing to think about, as I talked about in question number 3, about separating a GL, to the extent you have people spending more time accounting because it's a COVID-related expense, maybe you don't necessarily take your actual G&A rate. You can actually increase it because you've done some form of a time study or a labor distribution report to know that that amount has gone up. Over to Mike.
Thank you, John. So one of the main questions I've been fielding quite often is, I have an FTE reduction calculated. If I spend more than what my loan amount is, can I still get full forgiveness of my loan? The answer is maybe. It seems as though the SBA is kind of punting and allowing banks to make this decision. We reached out to the SBA directly, and they told us the bank's decision. So likely you can, and again, it's based on every bank. So reaching out to your bank, your representative, and asking them directly is a good thing to do before you apply for forgiveness. So you have the knowledge going in, will I be able to eliminate my FTE reduction if I have one through this application process? And they may or may not give you an actual answer, but it is at least worth reaching out to them. One of the other things that we keep getting asked is when can I record my PPP loan forgiveness as revenue, and then how much can I record as revenue? And there's definitely guidance that's been issued, but there's nothing really authoritative that says you have to do it X way or Y way. So the main two ways of recording are recording as it's either a liability or revenue. So you're required to either record it as debt, and then when you receive word that you actually got your forgiveness, some 150 days-ish later after you apply, maybe less, then you would record an extinguishment of debt and record the revenue then. The other way is to record it as a deferred revenue, a liability still, and then recognize the revenue as you overcome the barriers. It's essentially grant recording, grant revenue recording. As you overcome the barriers, you can then record the revenue. You could potentially do that in a piecemeal style. And the way I mean that is if you're a June 30th year-end, for example, you could record some revenue related to June 30th because you spent some of those funds prior to that point, and then record the rest of the revenue after June 30th in your next fiscal year. So another great question, how does all this funding interact with each other? We have so many different things. We have PPP loans. We have EIDL grants, and potentially EIDL loans, FEMA grants, FCC, HHS, all of these acronyms. How do they all play against each other? And which one should I use first? Which one should I use second? Everybody believes that they're the payer of last resort. FEMA has said that they're the payer of last resort. We just heard that HHS believes they're the payer of last resort. New York State funding agencies believe they're the payer of last resort because they're Medicaid funders. Who's really the payer of last resort is kind of a big question. Nobody, I think, really knows. But knowing that you have all of these different sources of funds, how those play with each other, I say, and which one do you use first, which one do you use second, which one do I have to use first, which one can I use, is super, super important. It's imperative. And trying to muddle through all of that information and all of those decisions alone is sometimes not the right answer. We're certainly here as a resource, and others as well. One of my personal favorites is the double dip thing. Yeah, maybe. It is absolutely a thing when it comes to your federal funds. If you have other federal grants, you have other federal sources of funding, you absolutely cannot. The Office of Budget Management and Budget released a memo regarding this. They said you absolutely cannot use $1 here and $1 there for that same dollar. When it comes to New York State, the O agencies, as we often call them, that answer is less clear. It seems as though you probably can't, but there's nothing definitive to say that you can't. We're hopeful that they will be able to issue some guidance to all of you in the near future, but it's kind of a wait-and-see game at this point, which is why I think Jeff had mentioned, wait, don't apply for forgiveness right away. There's really no reason to push and plow forward with applying for forgiveness when we don't really have all the answers.
I would add to that, as Jeff says, use the benefit of time. See what else can come out if they can clarify this issue. But certainly this is a significant issue. Jerry mentioned it in his presentation, Jeff mentioned it, Margaret mentioned it. When Terry talks in a moment, he'll be mentioning it as well. So it is out there, it is a real thing. If you look at the federal guidelines, they said, as Mike said, you cannot use assistance twice for the same expense. It's just a matter of getting those clear definitions and guidance from each of those departments of the alphabet soup that Mike showed earlier on.
Thanks, Jeff. The last one is, how does the PPP and HHS and all these other sources of funding affect my CFR? Terry's going to talk some more about that, so this is kind of like a teaser for that. There is a new schedule, a COVID schedule, that they are introducing for 6/30, 20, and going forward CFRs for likely the next 2 or maybe 3 cycles of CFRs, that they want you to report what are your expenses above and beyond your normal expenses in the CFR. The other thing is, another big question, this kind of goes back to double dip in some ways, is if I show a surplus in a program, is the state going to determine that I was then overfunded in that program and be looking to claw back some of those dollars? That's another question that unfortunately we don't have an answer to. I think that's something that you all are very well aware of, we are well aware of, and I think the state is also very well aware of. They're certainly in a budget crisis right now, so looking to claw back, quote-unquote, dollars that they believe that you already received from some other source of funds is certainly something that they could be doing to help shore up their fiscal liability.
All right, and I'll be continuing to monitor the questions, and we'll see what we'll be able to address as we further go out through the webinar.
Thank you, John. Thank you, Michael. So everyone has been waiting anxiously, I'm sure, for my colleague Terry Phillips to discuss the consolidated fiscal report and the impact that all of these activities may have in terms of reporting, et cetera. Terry, I will just remind you, since you're off-site, it is 1:30 p.m., and you should feel free to take 20 to 25 minutes, and that'll allow us to finish up here by 2:15 with John making his final presentation regarding single audit. So I'll turn it over to you, Terry.
Thank you, boss. Hello, everyone. They have isolated me, not because of they don't like me, but I'm quarantining because I went to a red state, and that means that when I visited my grandchildren last week, they live in Colorado and they are on the bad list, is what I call it. So I am quarantining myself for 14 days and not hanging out with the cool kids in the room. So, Mike, can you advance? I don't know who can advance the screens. Maybe.
Gary, I'll help you out.
All right, thank you. Appreciate it. You're much better looking than me anyway, so is it going? Can you move it? Or not? No, it's on the CFR concerns. All I see is CFR concerns. Did it move?
Terry, you should have.
We just gave
control.
you control, Terry.
Oh, I got control. All right.
As dangerous as that might be.
Hey, have respect. I still don't have it, Mike.
Okay, keep talking.
All right, so I'm going to go over a little bit over the double dip that we've been discussing, the potential for New York State funding clawback, reporting issues. Mike mentioned quickly the COVID-19 informational schedule. All right, the cost reporting and allocation considerations, because that's really going to be critical, as what happened there as we went to close down the day programs and the school programs. So there we go. The revenue recognition issues that we've been discussing throughout, and then lastly, should some costs not be reported on the CFR 1, and that would result in those costs being reported on CFR 2. And then lastly, all allowed cost considerations. This is a mini version. We've kind of pared it down to hit the critical items, and we will probably have a longer session if there's enough interest in preparing the CFR as we go through. So next page, Mike. So the guys have done a very good job in discussing the double dip of cost reporting. And you're going to see that the COVID-19 supplemental schedule tries to identify all the additional revenues that organizations have gotten for their programs. Now, it's only that report is only as good as that schedule is only as good as how they complete it and what's there. But certainly, with all the different funding sources, there is a concern that there is the ability to report costs in one program and then also report it in another program and get paid twice for that. And I think that we've done a pretty good job describing that. Certainly, Mike mentioned it just a minute ago that the Office of Management and Budget have built it into the uniform guidance. So that is actually out there to the different sources of federal awards, that they're well aware of what the double dip means. And then lastly on this page is those programs that are required to be reported on. The CFR will be required to report both the cost and the revenue recognized in program where the funds were used. So this is really important. This goes back to the question, who is the payer of last resort? Which I'm not at a point who's going to argue. They can argue that out themselves. But I will say this: we know that New York State Department of Education and OMH have, and OASIS have schedules, the tuition-based programs that there's offsetting revenues when they calculate the tuition in future years for this year. So what's going to happen is they're going to take that additional revenue that you receive, and they're going to offset that against the costs that have been reported. So it's important to capture both the cost and the revenue in the appropriate spots. And the same thing on those that are deficit-funded contracts by OPWDD, OMH, and OASIS. You will see on the DMH schedules that they also have a offsetting revenue calculation. So the only thing that doesn't have that is the Medicaid-funded programs, where they don't have a consideration of offsetting costs. So next slide. For this potential for New York State funding clawback, this is really going to be, Jerry mentioned it early on, without the bailout, how's this going to impact them? Do I believe that the state will become more aggressive? Remember this, they make the rules. They're the ones paying the checks. They make the rules. They have at times gone for changes in the waiver for Medicaid programs to CMS. They go to make legislative changes if they need to on deficit-funded contracts and other concerns. So they can and they will become, I think, a little bit more aggressive on the level of scrutiny that they're going to apply, especially depending, and we've seen this before, certainly in Medicaid, where we have a Medicaid overspending, they become more aggressive. OMH becomes more aggressive in paybacks and their audits. So I think we'll see that in the next year or two as we fall out, as the conclusion of the pandemic comes around. The second there is first consideration. So really what I want to get to is, how do you protect yourself from and keep as much of this funding as you possibly can? In what I say here is the first consideration be given to those programs that there is no state and federal or private funds. And that would be things such as a workshop where it's no longer funded, where there are programs that you are well underfunded. There are a number of programs that you're running big deficits in. So when Jerry and I meet with the boards and others, we meet with the board and say, you really need to look at these programs that are running large deficits, and are they still financially viable? Well, this year, you could use, if we spent the money for COVID, and I would certainly be applying the revenue that you receive for those to those programs as well. So PPP, loan forgiveness, where you have deficits in large programs and there is no additional funding, I'd be looking for that to put those costs associated with that against this program, that program. Mike, before submitting cost, this is the real thing that I get to on this one, is, go through this matrix, understand your programs, understand, do I have a chance of getting paid by someone else? Understand the impact of what will happen, and also the timing. So if you are looking at, the fiscal year files that are June 30th that are downstate, or the SET providers, and we got HHS funds that came in, well, or PPP, do I want to forgive as a 6/30/20, or do I want to wait to 6/30/21? Or the same thing for calendar year. Do I want to push off to the last 6 months of the HHS funding, or do I want to really kind of slow up and report things in the following year? And we know that we're not through the pandemic. We know there's going to be additional costs. We know there's additional costs on a per unit basis when we talk about rehabilitation services, because you have to social distance. People aren't coming back. There's a bunch of different costs that are there. So when you look at when to recognize revenue and what that means, this is really important. Those 3 steps, I think, are really important as you're starting to finalize your financial statements for this fiscal year and prepare for the calendar year coming up. So our friends at the state have developed a COVID-19 supplemental informational schedule. There are 2 schedules. One is COVID-19 supplemental schedule for most providers, and then there's a COVID-19S schedule for the said providers. There's a little bit of difference, and I'm going to explain the difference at the end here. But you will find this in your CFR manual, Section 33B. There's specific line-by-line instructions. And what New York State really wants to know, they've broken it down into 3 sections. The first section is the general information about COVID-19, which programs, and really what money, what funds you got. They focus primarily in PPP loans and loan forgiveness are the questions directed. And then also when you look at it, they are also focused in on what other funds you received in that first section. The second section looks just fairly similar to the CFR 1 in that they want to understand, what personal service costs you have, what other than personal services you have, and they're very specific. They want to know if you paid hazard pay in the downtime. Is that additional cost? They want to know about PPP. Did you have to set up additional spaces to isolate people? Is there additional food costs that were associated with this thing? The repairs and maintenance for excessive cleaning. That is all covered in this schedule, and it's important to understand that. So I tell providers to certainly spend a few minutes to read Section 33B. The difference with the said is that New York State went into a close down in, I think, March 17th for the Irishman that is St. Patrick's Day, and this year had the notoriety of the New York State shutdown. So on that date, what New York State Department of Education is concerned about is what changed in your program, what changed in your program costs. So a lot of organizations took either redeployed a number of people that work in the said programs to residential programs, to especially the aides, because it's hard to perform educational services to individuals with developmental disabilities or behavioral health issues, and aides were really became nominal in value in providing those services, especially when you're doing it online. So a lot of organizations either stopped paying them, laid them off, redeployed them, and New York State on the 19S program, they want to know what changed in your program. They want to know if you did redeploy people. They want to know, because they continue to fund you at your tuition rate. So there's an expectation that in this last quarter of the 1920 school year, that it's possible that the cost in that program would have went down artificially for 3 months. Now, as we ramp things back up as we go into this year, we're still slow in getting all the students enrolled in the special education process. So they need to understand as they work through the reconciliation and they're going to work through waivers, what's taking place. The more information we can give them, the better off we will be, because that will help us get back to our normal rates. I do know organizations who laid people off or redeployed people underspent in those tuition-based programs will have some type of liability due back to New York State because of that. We need to understand what's going to happen in 2 years from now when they do get the reconciliation process is complete. Mike, next thing. The next area that I really wanted to touch base on is cost allocation. I just mentioned real quickly that we see a number of people that were redeployed to residential programs. We also know that we got reimbursed for day-hab services provided in a residential program, and also ComHab-R that was provided for those who go to other people's day services programs. The problem is, as we know, in the ComHab rules, there's a 5% issue. Anybody who received additional income or net income that was greater than 5% is subject to a payback. I'm not sure if under COVID-19 if that's going to continue for ComHab-R, but cost allocating, how do I allocate people that are not normally in my residential program during those hours, and how do I split them between IRAs, day habilitation, ComHab-R? So Appendix J helps you out in that. There is a new section in Appendix J that allows you to allocate costs. They also tell you that you should be direct charging costs to these programs, and that Appendix J allocation methodology should be used as secondary. They also, if you don't believe that the methodologies that are in Appendix J, you can use alternative methodologies, but it is subject to additional scrutiny by the providers when they look at the costs going on. And I think that, and I said already, the concern about the using reassignment of staff is important. Lastly is the unallowable cost considerations, Appendix X in the said reimbursement manual. I think they're going to be there. They are making some exceptions on what an allowable cost is, and normally that there might be things such as food costs and other costs that were not allowable, but under the pandemic and under the public health emergency, those costs would be covered. I think that's really what I really wanted to touch base on for today, and I think that when we look at the CFR and we start putting it together, I think the concern will be, do I have people in the right places? Do I have the cost in the right places? And what are my options? So, Mr. Archibald, back to you.
Let me unmute. Can I unmute?
I can hear you.
You can hear me?
I can hear you. Yes, sir.
Okay. So the $64 million question for you first, and if Margaret is still on, she may want to weigh in on this. Are SED programs considered by the patient care for HHS funding definition? Does SED programs, are they going to be included as patient care for HHS or excluded? Do you know?
So,
if not, kick the $64 million over to Margaret.
Well, Margaret and I have discussed this several times. So I would say two things. One, most programs are not HHS because they're not Medicaid billable. So typical education programs, tuition-based programs are not. However, that said, related services, evaluations that are billed and are billed by the providers or others to Medicaid subsequent to the services being provided might be covered under HHS because there has been, we've seen a significant loss of revenue in those areas and additional costs as well. Margaret?
Yeah, I would agree with that. And I usually, as my rule of thumb, I usually advise people to think about if a person was eligible for Medicaid or another insurance, could you bill that service to an insurance company? And if you can, then it's probably allowable.
I think the only thing I was going to add is that we already know that the CFR deadline for the 6/30 filers have been extended to February 1st, 2021. So that is from a December 1st date. It's been extended 30 days. So please take note of that as well.
All right, we'll be moving into the next section. During Terry's presentation, we lost 20 people, so we will not take that personally. We do know it's Friday afternoon. I will be covering financial reporting matters, uniform guidance requirements, other things that can affect a single audit. Recognizing it's the day before Halloween, so I hope this is not the scariest thing you you have to deal with this weekend. All right, so financial reporting matters. Jeff did a good job discussing PPP, and I've seen a lot of questions come in on how should we be accounting for PPP if the loan's forgiven, or before year end or after year end. There's two approaches. There's the generally accepted approach. What I like to say is the PPP is a loan. It is debt. And it is going to be debt until that debt is forgiven. And the date it's forgiven is when you recognize a loan forgiveness. So when you really get into the accounting for it, the wording gets a little bit kind of screwy. It's almost a double negative. But really the reason it's recorded as debt is because the entity is not able to establish that it is not more than remote threshold for repayment. Meaning, I kind of look at that and saying, at some point, you do have to complete a loan forgiveness application. So is that remote? And we're saying that you might not be able to meet that. To me, this is also the most conservative treatment. Mike and I, when we were up here earlier answering some questions, we mentioned use the benefit of time. Keep it as debt. Part of that then is just as you finish out your accounting for that, record it as a non-current liability. Some of you are familiar when you do have debt payments, you classify your balance sheet. Well, we have current and non-current liability. You break out your debt payments as current and non-current, and that's based on actual payments, not when you expect forgiveness. So the accounting rules say that it should be a long-term liability until it's forgiven. And then also, for those that really want to get technical, you do not compute interest on keeping out this debt. But there is the alternative approach, which would allow you to recognize revenue if you meet what I would call the conditions. And this falls under the grants and guidance. So for some of the accountants that are on, you heard your auditors come out last year and talk about there's this new grants and guidance. We got to talk about are your conditions met, are your barriers met, right to refusal. This accounting is as soon as these CARES Act funds came out, I said this is why this pronouncement came out last year, because this is what can become applicable. So if you look at your PPP application or your loan application, and you knew when you filled it out that there was a forgiveness component, did you actually meet the conditions? And if you can say, I feel comfortable that we've met these conditions, there is going to be judgment involved. You do need to think about, well, did we reduce any FTEs? Did we reduce pay? Also have to think about, is that actual application for applying for loan forgiveness, is that a condition or administrative function? So again, judgment, think about it. It's really up to you to say, how do we want to account for it? But there's the two methods. And I've also seen some questions come in, well, how do we account for the provider relief fund? So earlier on, I said, well, what's not spent is a liability. Well, how do you recognize it as revenue? Again, you're going to follow the grants and contributions accounting guidance. And looking at, did we meet the conditions? Margaret's done a good job today outlining what the expenses are, what the lost revenue is. We know it's continually changing, but those are the conditions. Did you meet those conditions? And I would also encourage you to not just say, well, here's the financial terms, I've only read up to page 2. Remember, when you accepted those funds, through accepting them, or you actually completed the attestation, there's 10 pages of requirements. So it's not just about, do we have healthcare-related expenses and lost revenues. There's quite a few things in there that you need to do. One of them I pulled out and highlighted is you're unable to use any provider relief funds to pay money for salary in excess of the executive level, which is currently set at $197,300. But then when it does come time to recognizing the financial statements, I've been advising that it's an other operating income. So for those that kind of break out your financial statements between operating and non-operating, put that up into your operating section. And then any amounts received in excess of revenue that you're not going to recognize or you don't believe you met those conditions as of 12/31, you would record that as a liability. All right, single audit considerations. So within this room, I think there's probably four groups of people, 4 groups of organizations. Those that always have single audits know exactly what single audits are. Those that are at least familiar with it might have had it in the past or at a previous organization you were at. Those that say, I'm somewhat familiar with it, I've never really had to have it, not really quite sure what to do, and those that are just saying, John, it's 2 o'clock, I don't believe I'm going to have it, and I don't believe my provider relief funds are going to get to that point. I'm going to try to speak to, right now, because this is such a wide topic and a wide range of expertise, I'm just going to try to speak down the middle. So we use this term single audit. Some people say, well, what does that mean? I think it's important to understand why it's called a single audit, why that terminology is used. So we'll recall when Mike was going through the frequently asked questions, he said, here's all these departments, these acronyms between FCC, HHS, SBA. So all these different federal bureaucracies at one point used to distribute their grants, and then they had their own audit requirements. They would go out, execute them, report them, and say this is how it was spent. The federal government in 1984 said, we're going to create a single audit requirements relative to the internal controls and reporting. That's not to say there's not nuances amongst all the agencies, but now they're required basically to follow one single set of rules, and that's why it's called a single audit. This was updated in 1996, and most recently it was updated in 2014 to be referred to as the Uniform Administrative Requirements. Those 3 bullet points can be a 2-hour training of itself. Some of what we recall back in 2014 when the Uniform Administrative Requirements were coming out, there were multiple trainings on that. One of the key items to note is the threshold. Reporting entities that you're required to have a single audit if you expended the key word in there, $750,000 or more in the aggregate in federal financial assistance in 2020. So again, seeing the questions coming in saying, well, I received some, you could say, well, I received 800, but I did the calculation, I only expended 600. Those are going to be questions you have to start thinking about. Do I need a single audit? The other item is, this isn't just provider relief funds. So it's in the aggregate. So you could have received $300,000 in provider relief funds, but always had a grant, a continual annualized grant of $450,000 from another organization. That puts you at the $750,000 threshold, saying, geez, the single audit requirements might be kicking in. I need to start thinking about this. One of the things, too, is we see with a lot of clients, you might be receiving the federal funds or a grant you might be the subrecipient. It's important to know some of your grant sources, especially if you're close to getting a single audit, are those actually federal awards? Do they have CFDA attached to it? Items to start thinking about with 2 months to your year end. But I will say that last bullet, it is in the provider relief funds that these funds do have a CFDA number and are subject to the single audit.
John, a question just came in. Do they have or have they assigned a CFDA number for these funds yet?
Yes, they have. I apologize, it's not in front of me. It's back at my desk where it is. I'm not sure if Margaret has it, but one is assigned and we can get that out.
We'll send that out.
All right, so preparing for a single audit. If you've never had a single audit, what do you have to do? You heard me mention earlier when I was going over the frequently asked questions. You have to communicate to your governance and management that you've received these funds, the risks associated with it, and you might or you will have to have a single audit. Your boards, especially of organizations that have not had single audits before, might not understand what's occurring. Why is the auditor here? Why did the engagement letter look differently? Post-audit, why are there more reports or potentially more findings? You need to start getting them up to speed as well. Then I list, have you created a system of internal controls over compliance? So if you haven't had a single audit before, your auditor comes out and they assess your internal controls over financial reporting. The single audit is over compliance, so it's not just financial reporting related. And also what this means is we can talk about separate general ledger code, department track expenditures, but really, do you have a control? It's one thing to say we have control over the expenditure, but do you have a real control over that compliance? So a department head might sign off on it, and you put together the voucher. Does someone else come in and say, let me look over this voucher and make sure we did comply with all these funds? So again, the other thing I would start focusing on is making sure you have that appropriate support and documentation for those expenditures.
make sure you make a double copy or scan in twice those invoices and put them into a specific folder. The fourth bullet's pretty important too, and I alluded to this a little bit earlier, is make sure an individual knowledgeable of the grant requirements is accumulating the data and completing the reporting. So we understand, work remote environments, people are stressed out, people aren't finding times, and this is just another thing we have to do, but this is important. So maybe your admin coordinator or your admin assistant might not be the best person, given the level of scrutiny, to be coordinating all this and filling out the reporting. And then, again, I said it's not just financial in nature. There are 10 pages of terms and conditions that apply. Make sure you're aware of all of those when you assess your compliance. So what does the auditor do? This is probably, again, another slide that shouldn't be done in 5 bullets, but it's just for the purpose of today, just to kind of dip your toe in the water. You kind of already heard me allude to. The auditor, one of the things we have to do is we come in and we gain an understanding of your control environment. So everything I said on the previous slide that you should be doing, the auditor is going to come in and do that. We're going to assess behind the scenes what's the risk in noncompliance with expenditures of federal funds. We're going to think about, we know what the client is, we know what the control environment is. We're going to assess, well, geez, where could something go wrong? And one of the things we would look at if we're auditing these funds is saying, provider relief funds are a new program where the guidance has been ever changing and not always clear. So we consider that as part of our risk. We come in and we test controls over compliance. So I said that earlier. We're looking at your compliance controls, not just your controls over financial reporting. And then we'd also perform tests of compliance over the expenditures. This kind of seems weird. One's a test of controls, one's actual compliance. So you have an invoice, you said this is coronavirus related. We say, did the appropriate person sign off on this? Yes. Was this coronavirus related? That's the compliance piece? Yes. And then the 5th bullet is one of the most important, and it relates to the question that just came in. The CFDA number. So that's a program number that says this is what the grant is, this is what the audit requirements are. That has been assigned, but a compliance supplement. So what guides your controls and your compliance activities and also guides us as auditors has not been issued yet for any of the CARES Act programs, not just HHS and Provider Relief Fund. We're also seeing it in the Department of Education. That's outstanding. So as of today, I can't sit here and unequivocally tell you what we're going to test and how we're going to test it and how many need to be tested. Then the last point is reporting under the single audit. So what does the auditor report? You can see is we're required to report on your internal controls over financial reporting and also your internal controls over compliance and other matters required by government auditing standards. Some of you might not have had this level of reporting under government auditing standards. You might have had more of a typical audit opinion. Really, as it relates from an auditor side, I think some of our professional excellence or quality folks might kind of take this a little bit farther, but really the actual internal control documentation and testing we do as part of the audit, a regular audit versus a government auditing standards audit, isn't necessarily that much different. We still have to gain an understanding of the control environment. We have to test controls as necessary. Not too much different. But what is different is if we have a material weakness or significant deficiency, you would see that end up getting reported in your single audit package. Another report we have to do is your compliance with requirements applicable to each major program. So again, another audited report talking about the compliance requirements. And then lastly, there's a schedule of findings and question costs. So there's a schedule that goes through and says we issued an unmodified opinion on the financial statements. We had no significant deficiencies or material weaknesses in internal control over financial reporting, nothing wrong with compliance or requirements. But if there is, we're required to report any material weaknesses or significant deficiencies as findings. That's going to go right into a report. We're going to say what the cause, the effect, and how to remedy it. It's going right into the report, and then that goes to a federal clearinghouse where all the reports and financial statements are stored, and those become publicly available. So for those that have had single audit in the past, I can actually go and look up those financial statements and see how you did. All right, and that concludes the financial reporting and single audits.
John, there's been a number of questions that have come in the last half hour, so I'd like to do 12 minutes of questions if you can go back and look at those. With all due respect to the accounting firms that are on the panel here, we've still got over 400 or close to 400 people still on. I want you on the single audit front to ask your current auditors, and if you're going through an RFP process, ask the auditors that you're considering how many single audit reports they file each year, and whether or not they've been subjected to any criticism as a result of either their peer review process or any actions taken by Office of the Inspector General or any interactions they may have had related to their single audit reporting. This year is going to be, in my opinion, the most complicated of all of the single audit years since 1984. I am old enough to know that I have met the man who was a former retired Arthur Anderson partner who wrote the Single Audit Act law that was passed in 1984. So that'll tell you a little bit about just how long I've been involved here. And I would believe that with the amount of money that's being spent here this year and into next year, trillions and trillions of dollars. Obviously, we're talking about HHS and PRF, but we also know we've got an audit requirement on PPP loans over $2 million. It's going to be extremely important that your auditors know what they're doing and what they need to do in order to comply with the requirements that have been set forth. With that, I'd like to ask John, I'm sure there's a couple of questions there that John, or if Terry is still with us, or Margaret, if you'd like to ask them. If you want to ask it and answer it yourself, you're fine to do so.
One question came in, I believe I did address this right after it came in, is what will the testing requirements for the provider relief funds be? We do not know right now. As I mentioned, the compliance supplement is not out, but again, start getting yourself in the cadence of documenting what your expenses are, coding them, and making sure you have appropriate sign-off. Question falls to Jeff. Do we know if the PPP funds will be subject to a single audit?
At present, right now, they are not subject to single audit. So, as of the most recent guidance, the PPP funds are not subject to single audit.
Which is unusual, I would have to say, given what HHS has done on the PRF side. And again, I think we have to look for the next stimulus bill to see whether or not they're going to make any change in approach there. And as Jeff said earlier, the ability of the SBA to audit every PPP loan over $2 million, and the fact that it's not in their budget and they don't have people assigned to do it, leads me to the conclusion that they might be pushing that responsibility off to your independent auditors. We didn't lobby for that to happen.
Idle loans are considered federal funds.
So idle loans, Michael was just saying, if you didn't hear him, idle loans, emergency, whatever that stands for, disaster loans, I can't remember the I. EIDL loans are subject to a single audit. So when you're looking at your 750 number, you do want to make sure that you consider those as subject to the single audit as well. I also want to say that since April, I've been buying a cab driver hat every month, because if this thing goes on well into next year, I might be driving a cab or an Uber in order to make some money, depending upon how bad this thing gets. So hopefully John has another question so I can get off my personal matter.
That was one of the questions, was where can we find one of those hats? That question did come in.
All right, all of my cab driver hats come from Ireland, and you can find them on the internet. And if you'd like to have me give you the internet address, I'd be happy to do so.
All right. For single audit purposes, are lost revenues considered expenditures? The answer is yes.
Can you say that again, because that's important?
Our lost revenues, so when you do the lost revenue calculation, you're going to put provider relief funds against it. Are those considered expenditures for single audit purposes? And the response is, and the quick answer is yes.
Which may seem counterintuitive to most accountants to say that a lost revenue is an expenditure. It's certainly counterintuitive to me, but I didn't know the answer to that question until you just gave it to us.
The two-part question for Terry and Margaret. Margaret, first part, can HHS funds, provider relief funds, be used for day treatment programs? And the second part to Terry would be, for revenue when there are no retainer days received?
So as far as using for day treatment programs, yes. If that's something that you could bill an insurance company for, then I would consider it a healthcare service, and you could use that.
And repeat the question for Terry.
For day treatment programs, the loss of revenue where no retainer days were received can you use provider relief funds?
Day treatment programs?
Yes, day treatment.
I think it'd be again, it's the lost revenue. So that would be that. I think I'm in agreement with Margaret on that. But I thought
all of these questions, I might add, are going to be summarized, and we'll get written responses out along with the slides. Slides will come to you before the written responses because we've got close to 50 questions that we got to answer, and we want to be very, very careful that we word them in such a way that they are not subject to interpretation or multiple interpretations, I should say. John, we've got about 5 minutes if you want to ask a couple more questions.
All right.
We'll close it up.
Jeff, an organization received an EIDL loan from the SBA. Is that considered FEMA, and do we have to apply that before the PPP?
It is not considered FEMA. The EIDL loans are specifically through the SBA, so FEMA grants are a totally separate thing. They might have both come out of the CARES Act, but they're totally separate. And as far as applying something first or second, that gets back to the whole double dip question in terms of which one you would apply first, and I don't know, we really don't know clearly what the answer is to that question.
We will keep you posted. I think we mentioned, but we should mention again that when we do know what that next stimulus bill is going to be, even maybe before it's passed, we're going to set up another webinar either for the late December, early January, or late January as the progression goes with respect to that bill. Again, as I said earlier, most of what I've been hearing lately is that it's going to be post-election. Post-inauguration, not post-election. John?
But can I just add into something on that? If there is clarification and the state is not the provider of last resort, there will be changes in how we report costs on the CFR. So that is important to note. So if there is clarification that HHS or other federal dollars are the provider of last resort, and that we would have to do something with the cost being reported in the CFR programs, and also where the revenue is reported. So,
Terry, can you say that one more time? I'm not sure that it was loud enough. So if you want to yell a little louder, that might be helpful. So
what I'm saying is, if it comes out that the state of New York is no longer the provider of last resort, either in a SED program and or a program that's deficit funded, then it could change in how we report costs on the CFR. So that we need to understand that more clearly.
Thank you. John, one more question.
All right. Do we have to report PPP cash received in 2020 if it's not forgiven until 2021? I'll take that. From a financial statement reporting, I mentioned you'll report obviously the cash and then the expenditure of the cash you used on payroll, but you're not going to record the forgiveness until 2021 or until the forgiveness occurs.
So you'll record all the cash you received from PPP this year, but the question is, what's the split between a revenue item and a liability?
Mm-hmm. And that's based on if you're going to use the generally accepted method and keep it as debt, or if you're going to look at the alternative method and what you can recognize as revenue. So,
Jeff
just
and I
clarification.
Have been discussing whether or not we should be doing a separate webinar on revenue recognition, given all of these specific questions. So that might be a second webinar that we'll do separate from the next stimulus bill.
Hang on.
Sorry.
Yeah, just real clear. Even though that it's not going to be, it might not be recognized in revenue in 2020, the PPP loan forgiveness, it is required to be reported on the COVID-19 supplemental schedule in the CFR, and is shown as a loan on that schedule on the general information section.
And it's part of general information on your provider relief funds as well.
Okay, thank you. You've heard from 6 of our subject matter experts here today. I do want you to know within the healthcare tax exempt team, we have approximately 15 different individuals that are monitoring different aspects of the various stimulus and reporting issues that obviously are quite extensive based on the fact that we've just spent 2.5 hours, and in many cases we've just scratched the surface. So to the extent that your Bonadio representative can be helpful to you, we give you this as an indication of roughly half of the team in terms of the various email addresses. Each of our other offices have specialists in this area as well, so I don't want you to think that you have to necessarily contact one of us. You can contact directly your primary client service representative. If you're not a client of Bonadio, it would be best if you did send an email to one of the individuals on this particular slide. With that, many thanks. We still have 350 people on the line, so I don't know, John, we got one more, no, we don't have one more minute before 2:15. So we'll close out here, do the questions in written response form, send you the document slide deck, and we appreciate it and look for our next invite, if you will, because this is going to be an ongoing effort for the course of the pandemic, and we hope to have webinars hopefully on a monthly basis to keep you all updated, particularly through those December 31 year ends. Thank you very much.